Dr. Z and you're watching Dr. Z PhD, the place to be for expert info on gender. Now, when it comes down to getting breast augmentation, choosing breast size may be challenging and difficult to do, and many people actually opt out for whatever size doctor tends to recommend. But is that really the best way to go? Well, in this video, I'd like to share with you 4 very essential tips when it comes down to breast augmentation that can help you make a better decision for your life. And make sure to also subscribe to my channel so that way you don't miss any new content coming from me. Now, let me share with you 4 essential tips for you that can really be helpful when deciding on ideal breast size, and also can be helpful down the line on deciding on breast augmentation. So tip number 1, do give hormones some time. Listen, I get it. Many of you are very impatient and eager to get surgeries to help you achieve the body you have always wanted, especially since 1 year of being on hormones is not a requirement for breast augmentation. As a result, I see many trans women getting breast augmentation just in the very few months of starting hormones. Now, this can cause a problem. What kind of problem, you're wondering? Well, one, resulting in revision of your breast augmentation. And I think you really want to avoid that. Because if you get breast implants too early before giving your body time to develop on hormones, your breast tissue will start to grow on hormones naturally underneath the implant. Now, I have personally seen women needing breast revision exactly because of this. And I think all of you would rather really want to avoid revision and any kind of surgeries related to revision down the line. You really want to minimize the impact of surgery on your body. Not to mention the insurance may not really cover revision. Now, I know that hormone therapy is limited in terms of breast growth and development. And even with added progesterone into regimen, achieving breast size beyond B can be quite a challenge for a lot of women. And yet many report experiencing breast growth spur when they switch from oral to injections or when they add progesterone. So breast size does continue to develop over time. With all the eagerness, I still really do encourage you to give yourself some time on hormones, preferably a year prior to surgery. In fact, most surgeons would recommend a year on hormones to maximize not only breast growth, but also help obtain better surgical aesthetic results. Tip number 2. Find a surgeon specializing in trans care. Now, I can't stress this enough. Having a plastic surgeon who has done gazillion of breast implants on cisgendered body is very different than operating on trans body. It really is. Now, why? Because there are anatomical differences here at play, such as wider male chest, stronger pectoral fascia, more developed pectoral muscle, as well as smaller dimension of nipple and areola. All of this play a factor when we are constructing new breasts. All of those are really important. So as you can see, finding a doctor who is very skilled at trans care is imperative. Now, I have a link to my resource page listed below that specifies surgeon by expertise. So please take a look in case if you are planning on getting breast augmentation or any surgery. It's a great resource for you out there. Now, tip number 3. Don't be fooled by social ideas of large breasts as something that defines femininity. Very important to ask yourself, what kind of woman am I? Spend some time prior to surgery or any other surgeries you actually plan on getting to get in touch with your inner femininity. I see many women rushing into getting large breast size because they feel that that's the way a woman should look, or that the large breast size defines femininity. But they really don't, not at all. Your breast size doesn't in any way define your femininity or your womanhood. Only you can define that is for yourself. Your femininity is inner and internal and only true to yourself. That's why it's so important to ask yourself these questions, to spend some time contemplating how you really envision yourself as a woman. Remember, women come in all different shapes and sizes. That's the ultimate beauty of the feminine, is that we're all so drastically different. Don't be fooled that your possibility is highly dependent on breast size either, because it doesn't. Many women have small breast sizes, and even some prefer to have smaller breasts. That's just natural. That's just diversity of femininity. I know picking which size to go with is actually even a bigger challenge. And now that brings me to tip number 4, how to pick the right size. Well, for starters, while it is important to have a doctor opinion on which size is better for you, I have to caution you on this. Because only you and only you know your body most, and you know what's best for you, not your doctor. Now, while your doctor may actually know what proportionally is best, ask yourself where they get this idea of notion of what's proportional, especially since women's bodies really do range in size drastically. Remind yourselves that most plastic surgeons have an aesthetic proportion of what constitutes beautiful only based on symmetry. But what we find socially beautiful is also based on constructs. So your doctor may also have their own subjective ideas of what size is beautiful on women, but they're just that, their personal preferences. As you can see, it's important for you to figure out for yourself which breast size really works best for you. Now, the best way to do it is with an old-fashioned rice test. I know rice, we're really talking about grain here. What I really recommend is taking a plastic bag and filling it with rice. Here's the tip. About 5 ounces of rice is equivalent to 150 cc of implant. So if you plan on 300 cc, you will need about 10 ounces of rice. Also keep in mind that if your implant will be placed underneath your muscle, you may need to adjust size of your implants upward by about 15%. So in which case, just add a bit more rice. Now the great thing about the rice test is that you get to try on different sizes ranging from really small to really large to figure out what fits the best for you. Of course, this is completely unscientific. But guess what? So is listening to your doctor's opinion which size to go with is also unscientific. So I really encourage you to try and rice test if you're planning on breast augmentation. It will also surprise you, as some people may to think they need larger size only to decide that they want to go with a smaller size, and similarly some people think they really want a smaller size and only decide that larger feels more comfortable to them. Try it out. You have nothing to lose, not to mention you can do this in the privacy of your home if you're not out yet. So, just really try it out, try different sizes, wear it around the home, see how it feels, and see which one feels the most proportionate and right to your body. So there you go. Those are my 4 essential tips that are really important. Think about them, consider them. And what about you? Have you had breast augmentation? And if you did, how did you decide on which size to go with? Did you listen to your doctor? Did you do any kind of rice test? Sometimes doctors actually will recommend it. How did you come to the decision? So do share it below. I do love to hear your comments. And if you're new to this channel, consider subscribing. And I'll see you all next Friday. Bye.